Assalamu alaikum. My name is Dr. Anwar Farooq. Today we will be talk about asthma. What is the asthma? Sign and symptom of the asthma: exercise-induced asthma, occupational asthma, allergy-induced asthma. When to see a doctor? Causes of the asthma, risk factor during the asthma, complication, prevention, diagnosis, treatment. Let's start our lecture. Asthma. Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing and whistling sound. Wheezing when you breathe out and shortness of breath is called asthma. Symptom of the asthma: shortness of breath, chest tightness, wheezing when exhaling, trouble sleeping caused by shortness of breath, coughing or wheezing attacks that are worst by a respiratory virus such as a cold or the flu. Signs of the asthma: increasing difficulty breathing as measured with a device used to check how your lungs are working. The need to use a quick relief inhaler more often. On the other hand, for some people, asthma sign and symptom flare up in certain situations. Exercise-induced asthma, which may be worse when the air is cold and dry. Occupational asthma, triggered by workplace irritants such as the chemical fumes, gas, or dust. Allergy-induced asthma, triggered by airborne substances such as pollen, mold, spores, cockroach waste, or particles of the skin and dried saliva shed by pets. When to see a doctor? Rapid worsening of shortness or wheezing. No improvement even after using a quick relief inhaler. Shortness of breath when you are doing minimal physical activity. Causes of the asthma: airborne allergies such as the pollen, dust, mites, mold, spores, pet dander. Respiratory infections such as the common cold, physical activity, cold air pollutants and irritants such as smoke. Certain medications including beta blockers, aspirin, and non-steroidal anti-inflammatory drugs. Strong emotion and stress. Gastroesophageal reflux disease, risk factor of the asthma: having a blood relative with asthma such as the parent or sibling, having another allergy condition such as the atopic dermatitis which cause red itchy skin, or hay fever which cause a runny nose and congestions. Being overweight, being a smoker, exposure to second-hand smoke, exposure to exhaust fumes or other types of the pollution, exposure to occupational triggers such as the chemical used in farming, hairdressing, and manufacturing. Complications: asthma complication as following: signs and symptoms that interfere with sleep, work, and other activities. Sick days from work or school during asthma flare-ups, a permanent narrowing of the tubes that carry air to and from your lungs, which affects how well you can breathe. Emergency room visits and hospitalization for severe asthma attack. Side effects from long-term use of some medication used to siblings. Severe asthma prevention: follow your asthma active action plan. Get vaccinated from influenza and pneumonia. Identify and avoid asthma trigger. Monitor your breathing. Identify and treat attack early. Take your medication as prescribed. Pay attention to increasing quick relief inhaler use. Diagnosis: physical examination, test to measure lung function, spirometry, peak flow. Additional test: methacholine challenge, imaging test, allergy testing, nitric oxide test, sputum eosinophils, provocative testing for exercise and cold induced asthma. There are a lot of homeopathic medicine which can be used according to the symptomatology, but the two topmost medicine which are generally used in homeopathy for the asthma, that is the aconite and the apica. Thank you very much for like and share this video.